So let's talk about the strikes. Now, over the recent weeks, the NHS, the Royal Mail, and the train service have all seen strikes. And yes, for the average person, this has been massively inconvenient and it's caused disruption to our everyday lives. But we've got to look past the curtain and figure out why these are happening and what could have been done previously to prevent it. Now, our NHS is massively underfunded and it has been for a number of years. Do you remember this statement by Boris Johnson during the Brexit campaign? Yep, you remember that big red bus. Okay. Now, this was actually proven to be a clear misuse of official statistics by Full Fact. That didn't stop Boris, though. He actually doubled down on the claims and stated that the sum would actually be £438 million and that we'd take control of this by 2021. Between 2008 and 2019, however, the NHS budget only rose by a pitiful 1.4% a year. Now, this is almost 2.5% less than the average rise since the NHS was established. And not only that, they didn't protect the whole budget, which meant that frontline cuts had to happen. That is where people like me and you start to see the pinch. But let's look at something else for a second. Now, during the pandemic, everybody in the UK stood outside their homes, on their balconies, outside their workplace at 8 o'clock every Thursday night like clockwork and clapped. Why wouldn't we? They're frontline workers. They were doing amazing work. And rightfully so, they were shown support. We were led every week in this by Boris and his lackeys. And in fact, during one of these spectacles, the current Prime Minister Rishi Sunak was even heard telling the press that they would give nurses whatever they needed. Well, let's take a look at the facts. Nurses, they needed PPE that worked. They just didn't get it. The NHS needs more staff, and they aren't getting it. So what exactly has Rishi Sunak and the Conservative government given them other than dangerous working environments, PPE that doesn't work, and a real-term pay cut in the last decade? Now, the average pay for a nurse in the UK is £35,000 a year. And from the outside, we all look at that and we think, do you know what, it's a really comfortable wage. And even during our cost of living crisis, they should be comfortable. But if we look deeper into the figures, we can see that this is down 8% in real terms since 2010. And the Royal College of Nursing claim that some experienced nursing roles have actually seen a real terms wage cut as high as 20%. The starting wage for a nurse is £27,000 a year, with pay rises only offered every 2, so again, not terrible, but it's a graduate role, and an extremely specialised one, and that salary is simply pathetic. And then you have the bandings. A lot of nurses are band 5, which is where you start. Once you reach the top of band 5, you don't get any more pay rises. That's it. Unless you want to go and become a sister, or a more specialised nurse and move into band 6, which not everybody wants to do, you won't get a pay rise. Is that fair? You're still on the front line. You're still doing a dangerous job. And if you're not getting a pay rise, that doesn't mean inflation doesn't go up for you. It still affects your outgoings. But it's not only about pay. This is also about the dangerously low staffing levels some nurses have to deal with on a daily basis. Figures from NHS Digital show there are a record 47,496 full-time equivalent nursing vacancies in England alone at the end of September. That represents a vacancy rate of 11.9%. I haven't looked into Scotland and Wales. I can imagine those figures, why not that high due to a smaller population? The percentage will be very similar. This only goes to show that we simply don't have enough new nurses coming through university at present. But why are you going to want to go into a job where you're undervalued, overworked, and placed in dangerous working conditions on a daily basis? Now, in 2019, Boris Johnson and the Tories pledged in their manifesto to recruit 50,000 more nurses for the NHS. The actual wording was 50,000 new nurses. So remember the word recruit and the word new, because we're going to look behind the curtain again and see how much of that was true and how much of it is just lies. Out of the 50,000 new nurses that the Tory government were going to recruit for the NHS, 18,500 of those nurses were nurses who would have been retained. So these nurses are already working in the NHS. They're already working in your hospitals. They're not new. So 8 out of 50,000, almost 20,000 of that, they're already working for NHS. They're not new nurses. Just let that sink in for a second. And if you remember, this is the same lies and the same talk and the same abuse of figures that this Tory government have given us over the police levels. They did the same thing. So these nurses, they already work there. They're already bodies. When it comes to the staffing numbers, they're already there. They're not going to help with the dangerous staffing levels that exist right now because they're already part of that staffing level. All he did was tell us a downright lie, worded it in a way to grab headlines and win the election. And he wanted to make the general public, who don't look past the headlines, don't look past the big figures, think that they were doing something to help. And it is yet more evidence that this Conservative government are underhanded, untrustworthy, and feel it is perfectly acceptable to take voters and the country and the general public for complete idiots. Yes, what the Royal College of Nursing have asked for is a pie-in-the-sky number. But when you factor in the lowball pay rises they've had for the best part of a decade, you can see why they're demanding it. Had they had fair and just pay rises over the last decade, this wouldn't be happening. Instead, the NHS has been underfunded, undervalued, and left to rot. And part of me thinks, and part of a lot of people within the UK thinks, this was done as a ploy by the Conservative government to hopefully privatise our NHS. That cannot happen. We have to fight back on that. If you think a private health service is what this country needs, please just go and have a look how much it costs you to have a baby in the United States. I recently watched a video where after insurance, they still had a bill for $4,500 for their baby. Perfectly normal birth, perfectly normal delivery, no health issues, but they still had to pay $4,500 after that baby was born, after insurance had covered the large quantity or large amount of money that that hospital had billed them for. Now, the strikes by the Royal Mail are different. Royal Mail is a private company, not that Rishi remembers that.
But gratitude and appreciation for the hard work of our postal workers. But when it is not the right approach. It is not the right approach to go on strike, especially demanding pay, as we have heard, that is simply unaffordable for hard-working British taxpayers. The Honourable Lady would do well to see that, because in the context...
Have you seen this clip? They reported profits of £758 million up to March 2022. And in 2021, they reported £702 million. These are the highest profits Royal Mail have recorded since 2013. And it was up by almost £400 million from 2020 to 2021. Now, put yourself in their shoes. If your company is reporting what are record profits and you are not being treated fairly for the service you're providing that is delivering those profits and not being compensated as a result, what would you do? What would you do? This has been a mismanagement of a epic proportion. And while we miss out on a few parcels, and yes, at this time of year at Christmas, it's not great and everybody wants our parcels, had the fat cats at the top simply shared more of their cream and cared enough about their staff, this wouldn't be happening. But do you know what? Sod it. Let's all go outside tonight and let's go and clap for them. Because that's all these frontline workers need to pay their bills, isn't it?